All right. Hi, everyone. Thank you for joining us for today's webinar, Parental Loss from Drug Overdose, Science and Response Strategies to Support Children and Their Families. We will get started in about 4 minutes. Thank you, everyone, for joining us for today's webinar, Parental Loss from Drug Overdose, Science and Response Strategies to Support Children and Their Families. My name is Marla Kaufman. I'm the Senior Communication and Health Promotion Associate at IRETA. I will be moderating our webinar today. Before I introduce our presenters, I would like to go over some quick housekeeping items about how to access continuing education credits. This webinar is approved for 1.5 PCB and/or NADAC credits, which are free. A standard certificate of attendance will also be available for download. If you would like to obtain CEUs for attending this presentation, you will need to do a self-attestation and fill out a brief essay question after the webinar. You can do this by taking the following steps. You will log into your My IRETA profile or create a new profile. I will copy and paste the link into the chat box. The link above will the link that I will paste into the chat box will take you directly to the page for this webinar. After the webinar, you'll answer the attendance question and a brief essay question. You will then receive an email letting you know when your certificate is available. Please note that it may take up to a week for us to process the certificates. It is possible this email may go to your spam folder, so please check there as well. You can also log into your My IRETA account to check on the status of your certificate. If you have attended our webinars in the past, you will notice that we are doing things a little differently currently. Please have some patience with us while we adopt to some new processes to improve our webinars. If you have any questions regarding CEUs, please feel free to email me directly at marla@ireta.org. And if you're just logging in, I will go over these instructions again at the end of the webinar for CEUs. If you have any questions throughout the webinar today, please use the chat box. We will pause occasionally for Q&A and of course leave some time for questions and discussion before we wrap up. Today's recording will be shared with all attendees after the webinar. We will also be posting the recording and slide deck onto our webinar within the next week. I would now like to briefly introduce today's presenting organizations, which are HopeHQ and IRETA. The individual presenters will introduce themselves in more detail. First, Dr. Eric Halsey will be presenting on behalf of IRETA. Dr. Eric Halsey is the Executive Director of IRETA based in Pittsburgh, Pennsylvania. He has over 20 years of experience in overdose prevention and substance use disorder treatment systems and is a former family therapist. His dissertation focused on childhood bereavement, and he has since developed and published methods to evaluate bereavement support programs and estimate the prevalence of childhood bereavement, including parental loss from overdose, suicides, and homicides. We will also have a team presenting from HopeHQ, which Dr. Halsey will introduce. HopeHQ's mission is for children bereaved by their parents' overdose death to thrive through optimized and coordinated support services. All right, if everyone is ready, I will switch over to the other slides and let Dr. Halsey kick things off.
Thank you, Marla. Get myself settled here. Well, good afternoon if you're in the afternoon time zones, but welcome to everyone. We're so glad to convene with you all today to bring attention to the children who've experienced the loss of a parent as a result of overdose. For many years, the U.S. has been in an overdose crisis, and responses, rightfully, they've focused on people who are vulnerable to an overdose. But more than 2/3 of those people who have died are in their child rearing years, ages 25 to about 54. There's a whole generation of children who've experienced the impact of the national overdose crisis, whose experience hasn't received adequate attention, and our efforts hope to change that in some way. But I'd like to start with a brief story of how we arrived here today. About 20 years ago, I was conducting an evaluation of a local bereavement center's programming, and as part of my dissertation, I was volunteering with a local harm reduction organization to train people on the use of naloxone and distribute it, which was a response to the increase in fatal overdoses that we were observing. Years later, when I was at our county's Department of Human Services here in Pittsburgh, I had the idea to try and connect these dots and examine the number of children who lost a parent related to overdose. We had also included homicides and suicides in that analysis. But that resulted in a publication, which we'll share in a few moments. But I had ended that article with a statement: public discourse regarding approaches and policies to address the effect of unexpected loss among children is warranted, because it's an under-recognized dimension of the country's overdose epidemic. Well, a few years later, I received an email from a nice guy at the University of Michigan. This is my colleague, Sean, who you'll hear from after I present. He was interested in this topic and had some questions about my publication. And there began a partnership that has conducted research, published some peer-reviewed articles on this topic. It also resulted us beginning a dialogue with caring public health professionals who work within the Michigan Department of Health and Human Services Overdose Data to Action team and vital statistics teams within that department. And all around this topic, and we wanted to examine the magnitude of that issue. Last year, those teams published a thoughtful data brief, which we'll present to you, but it was entitled Children Whose Parents Died Due to Drug Poisoning, Michigan 2000 to 2022. And following that, later in the year, our Allegheny County Department of Human Services, based here in Pittsburgh, someone can't hear the audio? Apologize. I'll try and speak louder if we're having an issue with that. Our county's Department of Human Services published a report, The Children and Young Adults Who Lost a Parent to an Overdose, which expanded on that initial analysis and carefully examined parents' system involvements prior to the fatal overdose. There's also been an increase in the peer-reviewed literature around this topic from federal agencies and others. Now, a core function of public health is to identify the magnitude and potential impacts of health challenges so that we can respond effectively. When I had published that first research letter, I had argued for that public discourse, and I'm pleased to see more attention, research, and discourse in today's webinar as a part of that about how the overdose epidemic might be impacting future generations. So, and with that little story, I think we'll just jump into to the presentation. Um, so who we are, our organizations. IRETA is a nonprofit, as Marla had said, based in Pittsburgh, Pennsylvania for the last over 26 years. And its mission is to help people respond effectively to substance use and related problems through quality improvement, education, technical assistance, and research activities. HopeHQ is a collaboration between the University of Michigan, Wayne State University, and many community and state partners. They're an interdisciplinary team whose mission is for children bereaved by their parents' overdose death to thrive through optimized and coordinated support services. And here's our panel of presenters. As Marla said, following my presentation, I'll introduce Sean, he'll introduce Louisa, and she will introduce Melanie. Our learning objectives today, we aim to summarize the prevalence and trends of parents who've died from overdose death and the health outcomes of children bereaved from that experience. We want to explain the experience of families bereaved by overdose death. And finally, develop or at least begin a dialogue in developing strategies to support children and families who've had this experience. Next slide. Okay. I think we go to the next slide, Marlo. So just for a little foundation, ground level, with the new National Survey on Drug Use and Health, well, from 2024, and the methodology was changed a little bit, but regardless, it's a household survey. And what we learned is that over 48 million US adults met criteria for a DSM-5 substance use disorder. That's the Diagnostic Statistics Manual of a substance use disorder. Extending that, trying to assess how many children may live in those households, our research showed that about 1 in 4 US children lives with at least one parent in a household who met criteria for a substance use disorder. Parental substance use disorder and substance use is known to have different impacts on parental functioning, attachment, family relationships. And we're talking about substance use disorders. That includes alcohol, stimulants, as well as opioids. So not all of these are necessarily at risk or contribute to the huge problem we have in the country, but it's sort of a foundational statistic on what we're talking about today. Next slide. I have been doing overdose prevention work in various capacities for over 20 years, and it never fails to surprise me and shock me when I see statistics like this. Since 2000, we've lost more than 1 million Americans due to overdose. It's pretty stark. And as I said before, many of these overdose deaths are among people of childbearing and child parenting ages. Up into the peak in 2023, where we saw about 105 overdose fatalities in the country through CDC's National Vital Statistics system. Since that estimate has come out, these overdoses have come down, thankfully, still alarmingly high, but it remains a leading cause of death for Americans aged 18 to 44. Next slide. But what about all of those who've been left behind by these deaths? And that number is ever growing. A recent national study found that over 40% of US adults reported personally knowing at least one person who died by overdose. And that's about, 1 in 8 American adults. Another study showed that in the 10 years between 2011 and 21, over 320,000 US children experienced the death of a parent from drug overdose. that actually came out of some of our federal agencies. A person who was leading our Center for Substance Abuse Prevention and other federal agencies actually released that study, which really, I think, was landmark, kind of helped to put this issue on the map. Next slide. So how does this affect, children? They are parental substance use and parental death are considered adverse childhood experiences, one of the ACEs, if you're familiar. When a child experiences a parental death from overdose, they're often experiencing secondary losses, including changes in caregivers or residents or economic insecurity. And they also may experience other unique stressors, including family responsibilities, disruption of daily routines, and perhaps surviving caregivers with elevated distress levels. It can also affect their academic performance at school. They also can affect the bereaved child's physical health outcomes over their lifetime through the dysregulation of the biological stress response systems, as well as potentially their own risks in the future for mortality. So these bereaved children are at increased risk for mental health problems, suicide, substance use disorder. But I'm going to present to you one thing that we examined in our local county about what happened in the months and years following this experience of a parental overdose loss. Next slide, Marla. What you see here is a chart out of one of those publications. And a team that was working with me, we looked at what happened in the months. We were very unique here in Allegheny County. We have all this integrated data of all the public systems. And we looked at the parents who we had learned, the adults we had learned had died of an overdose death, took a look to see if they were listed on a birth certificate, and then looked at the children when they were born, what age they may have experienced the loss of the parent, biological parent, that is. And what we asked what happened in the months and years after we had access to all these public systems, and we found two things kind of were not necessarily surprising, but were sort of stuck out for us. Is this blue line you hear, this is for those who were consistently enrolled in Medicaid. We found an increase in the utilization of mental health services over the months and years following a parent's overdose. We also found child welfare involvement. You can see that dark line there. And many counties and states around the country, their child welfare systems, as a result from substance use, not necessarily overdose, but substance use, have really experienced the burden related to that. Next slide. So the future, if things continue as they are, one study, it's predicted that 4.3 million children and their families will be affected by this crisis if things continue. And there's also, an economic perspective to that. Things covering expenses like healthcare, supporting kids in foster care, social services, education for children with special needs, and law enforcement. So when a parent dies from an overdose, it's crucial we support their families to prevent long-term harm to the children and others who are left behind. And I just want to present to you, and Marla, you can go to the next slide. Marla shared with you, we'll share the slides and the recording afterwards, but the report that came out of Allegheny County, Pennsylvania, Data-Driven Insights Transforming, Children and Young Adults in Allegheny County Who Lost a Parent to an Overdose 2016 to 2023. You can find that online. The link is there, but we'll share this with you as well. And then the next one that had come out of Michigan that I mentioned earlier is, children whose parents died due to drug poisoning. And so they did this analysis similar to what I had described to you to count the number of children, in Michigan who may be experiencing that. So with that, I'm going to introduce my colleague, Sean, who will pick up on this, but let me introduce him formally. Dr. Sean Esteban McCabe is a professor at the University of Michigan and the director for the Center for Study of Drugs, Alcohol, Smoking, and Health, or the DASH Center. He's a co-founder of HopeHQ and has published over 300 peer-reviewed articles and led 15 federally funded grants. He's worked clinically in several settings in the addiction field, including counseling centers, courts, schools, and correctional facilities. He coached high school football and mentored young people who have experienced parental overdose death. In addition to his research on substance use disorders, he serves as a volunteer bereavement group facilitator for children at Ellie's Place, a community-based organization in Michigan that serves bereaved children and families. And with that, Sean, please feel free to take it away.
Thank you, Eric. I appreciate it. And before I begin, I want to dedicate my portion of the presentation today to my mother, who died last March, and today would have been her 90th birthday. She spent her whole life raising, serving, and teaching children, and the greatest gift I could give her is to pay it forward. I also want to acknowledge my friends and loved ones who have died from drug overdoses and their brave children who are navigating the world without their parents. Eric, I'm especially grateful for you for responding to that email years ago, and that we're all here today together. I reached out to you largely because I was really impressed with your study. It really put the human component to it. And I was surprised that children weren't getting more attention who had experienced overdose. That was something that really jumped out to me. And one thing I'll say is, you know, you and I really share a dream of making sure that every bereaved child is counted and that no child grieves alone. And that's an important dream. That's an important mission, if you will. And I know that's shared by a lot of people that we work with. And years ago, I was sitting in an audience of a university talk that someone was giving about the opioid crisis. And I was sitting with a boy whose dad had died from a drug overdose. And during one of the slides, he told me about some of the ways that his dad was so much more than a dot on a map. And it was during a slide where they were showing a map and they had like all these dots to reflect people who had died. And he recognized that his dad was one of those dots. And, you know, I agreed with him 100%. And, you know, I like to use data quite a bit. But I also think it's important that we figure out how to show and how to use data in some ways where data science can be used to help bereaved children and families, because all the numbers in the world mean very little if they can't be used to help change lives. Next slide, please. So this figure to the left shows that parental drug overdose deaths make up an increasingly large share of all parental deaths in Michigan. And this is something that we've seen across our country. This is some study that Eric led. And what he showed is that between 2000 and 2022, the proportion of children who experience parental drug overdose deaths versus other causes of parental death more than tripled. Going from 7% in 2000 to the left and 22% in 2022 to the right. That means that more than 1 in 5 children who experienced a parental death was due to drug overdose. And I volunteer at a children's bereavement agency, as Eric had pointed out, in Michigan, and we have noticed the impact of this shift over time, especially in our teen groups. Parental overdose deaths is a leading driver of parental mortality, and it represents a serious public health concern, particularly here in the United States. And it impacts some states like Michigan and Pennsylvania harder than others. Our team used both the birth records and death records to determine the age breakdown. And this is where some of the work that Eric does, and it was interesting because it takes a lot for me to be impressed with you know, the way people work with data. And when I started working with Eric, I was really impressed because he really positions the person in the middle of this and the so what. And what he was able to show with this analysis is that if you look at the pie chart on the right, you'll see that he was able to identify the ages of kids at different who had experienced a parental drug overdose. And the reason this is important is because a lot of us who work in children's bereavement we know that the services that we provide are broken down by these ages. And so it is really important to know who's going to be coming through those doors and who's going to be experiencing these parental deaths. And so Eric showed that 10% of those kiddos, and we call them kiddos at the agency I work, so please, roll with me here. 10% of the kiddos were age 5 and under, 35% were ages 6 to 11, and 55% were ages 12 to 17. And that's the age that I work with. And so for those of us who work with teenagers and children's bereavement, this information was so important for both planning and training purposes, because childhood bereavement services, as I mentioned, are offered a lot of times by these age groups. And so if you think about this, this is really the middle schoolers and the high schoolers that are more likely to experience these parental drug overdose deaths. Next slide, please. So this next graph comes out of the Michigan Department of Health and Human Services. They did a great job in their report, and that link is down at the bottom. We had some similar analysis that we ran, but I wanted to highlight the work of MDHHS, so I cited their work here. What this shows is the cumulative total of children who experienced fatal parental drug overdoses, shown in the black trend line, over time has increased. So you can see that pretty stark increase in that with that black line, and it's now at an all-time high. These findings underscore why a statewide coordinated approach to identifying service gaps and improving access to grief support is urgently needed. In recent years, we've seen people celebrate annual declines in drug overdose deaths. Like this past year and the year before, there were declines. And that is something that we should celebrate. And it's also something, an outcome, if we can reduce parental overdose deaths, then that's going to help reduce the number of kids. So that's a very important outcome. However, this is important. When we're thinking about the children, we have to realize that it's important to understand that bereavement does not operate on a 12-month cycle, which is why we continue to see increases in the number of bereaved children, even during years when overdoses are going down. So if we have a decrease, well, you can see that right on that graph there on the green bar chart, you can see that there's years where the overdoses go down, but that black line goes up. And that's because those kids cumulatively are still seeing increases because the overall base rates, the annual rates of overdoses are so much higher in these recent years that it's still increasing the number of kids, and they're on an 18-year clock. The other thing I want to say is that, we put a lot of emphasis on this 18 and under, but I got to say, somebody that works for kids, and a lot of you out there who work with kids, you know that just because a child turns 18 does not mean that they stop grieving. We are seeing a growing population of young adults who need bereavement support as well. Next slide, please. Between 2000 and 2023, we identified more than 115,000 parentally bereaved children from all-cause parental deaths in Michigan. This included 38,000 children who experienced parental deaths from stigmatized causes, and those are defined as suicide, homicide, or overdose. That total of parentally bereaved children is larger than the number of people who fill the Michigan Stadium, which is the largest stadium in North America, and nearly 2 in every 5 of those bereaved children who would fill up that stadium and be overflowing would have lost a parent to suicide, homicide, or overdose. And I just want you to stop, those of you who have been in Michigan Stadium, or those of you in Pennsylvania who have been in the Penn State Happy Valley Stadium. I mean, you just have to understand, we are talking about an incredible number of bereaved kids if you think about those numbers, just looking at that stadium. The annual percentage of children with parental bereavement from stigmatized death relative to all-cause deaths has significantly increased from 2000 to 2023, as shown in the figure to the right. This was something that our team published in JAMA Network Open a few months back, and what we showed is that the percentage of stigmatized parental deaths went from 28.5% in 2008 to 42% of all parental deaths by 2023. And most of these stigmatized deaths were due to drug overdose. Next slide, please. Our HopeHQ team conducted the first statewide investigation to examine childhood mortality among bereaved children who have experienced parental deaths from drug overdose. Death records were used from bereaved children themselves to identify childhood mortality cases defined as kids who died before age 18 as a function of the cause of parental death. Between 2009 and 2023, the overall childhood death rate for all of Michigan children was about 5 child deaths per 10,000 children. However, the child death rate for bereaved children who experienced parental death by drug overdose was 700% higher. It's important to identify and reach these at-risk youth because early evidence-based interventions have been shown to improve their health outcomes. And our team is currently using these findings to examine which types of bereavement services save lives. I just want to highlight that again. That blue line there is 700 times larger than the orange line. And the reason our team felt like it was so important to get these baseline numbers down is because when we move forward and we start evaluating these bereavement services and the efforts that we're making in our communities, we need to be able to know what the overall state metrics look like so that we can compare whether what we're doing is successful or not. Also, one of the things that we're really wrestling with in the field is what kind of metrics, what kind of measures can we use to measure success? And I would argue that the kids who have experienced some of these different types of parental deaths, we can look at the services that are being provided and really compare them and be able to see what types of services, but also like how long should they be provided, what's really making a difference. And so this isn't just about data or research. This is also about tools that we can use to see what's working. Because one of the things that's really missing from the field right now is we don't always know what's working. And with these kids who are extremely vulnerable, we don't want to be doing more harm than good. And so there really needs to be a push in the field to really start to show successful outcomes. And this is just one outcome that can be used. Next slide, please. So grief is a universal human experience, and it's really not easy for many people to talk about. I see this quite often with the youth that we work with. And people may not feel comfortable around someone who's grieving, especially when it's for a drug-related reason. It can make grief even more complicated. Experiencing the death of a family member from drug-related causes is really different from grieving a death for other causes. Addiction affects the whole family, and it can have a ripple effect. It causes harm to individuals and their loved ones. And addiction can make it hard to manage daily life. It can lead to problems with money, employment, housing, and the law. Children, family, and friends worry and often feel a lack of control. They experience a roller coaster of emotions, including the hope of recovery. I can't tell you how many kids just hope and pray for recovery. And once their parent is gone, a lot of times they'll just kind of reminisce, about these brief periods of hope. And I also had one of our kiddos who missed his dad, and it was the highlight of his life when his dad was able to recover for a period of time. We actually tracked down one of his dad's open talks. And that kiddo is now a young adult. And on his way to work, he listens to his dad's open talk because it was the highlight of his childhood. And he wants to feel connected to his dad. Growing up in a household with parental addiction is considered an adverse childhood experience, which increases a child's risk, as Eric said, about academic problems, chronic health conditions, substance use, and in some cases, the need for the child welfare system to be involved. Children may have been anticipating the death to occur for years, especially if their parents have really been struggling health-wise. So when their parent dies from an overdose, it's like losing them twice, first to their addiction and second to their death. Next slide, please. When a parent dies from a drug overdose, their children and family often face not only grief, but also stigma associated with having a drug-involved parent. The stigma surrounding addiction can extend to those who are left behind. Some bereaved children or families might not be open about how their loved one died, fearing that others won't understand. This can lead to what's called disenfranchised grief. And this is a term that Kenneth Doka used to describe a kind of silent grief when the loss isn't really acknowledged or supported like other types of bereavement. The sudden nature, the sudden nature of an overdose death can be really hard for children because they don't get a chance to say goodbye. And this is something that a lot of the kiddos who've experienced this really need to do bereavement work around this issue that can be really different from other types of death. Their unanswered questions can complicate the bereavement process. And one of our colleagues, Dr. Julie Kaplow, talks a lot about this, that circumstantial grief. In other words, all of the details and circumstances around the death, like did my person feel pain? You know, did they hurt before they died? What was the overdose like? Sometimes that's very different for these types of deaths than other types of death. And so some bereavement programs might bring in a health professional to answer questions that little kiddos have about, you know, just details around the death. And sometimes that can be done with families or as individuals or in groups. Sometimes you just need to be careful that it doesn't trigger other kids. And some of these children actually don't know what the cause of death is. And so this has to be dealt with carefully, but it's also a type of grief that's very unique to overdose that can differ from other types of deaths. So in a recent study, Michigan families who were bereaved by a drug overdose or drug-related death were interviewed. And these families spoke about how stigma influenced their ability to be open with others about the cause of death. And stigma was a big part and a big reason why people do not know how to support those bereaved by a drug-related death. Next slide, please. You'll see here to the left, a bereaved mother in the green quote says, I think a lot of this deliberate avoidance is they don't know how I would take it, and they don't want to make me cry. Although participants felt that their friends and family were trying to protect them by avoiding discussions about the deceased, many wished for more open communication about the death and their grief experience. One of the most significant findings was importance of support from other people who had experienced a similar loss. A bereaved sister said, I think it's helpful to know other people who are going through the same things or who have been through the same things. Universally, we see healing in this shared support. And I see this often with bereaved teenagers that I work with. Their closest friends do not know how to talk to them about their parent who died. So often they completely shut down until they come to the bereavement agency, where they can finally talk about their parent who died with other people who truly understand. The challenge for bereavement research and those of us who work in this space moving forward will be how to measure the unconditional love and support and healing that takes place in these groups. Next, my partner in health and co-founder of HopeHQ, Dr. Louisa Kamp, will focus more on the strategies on how to support bereaved children and families. Dr. Kamp is an assistant professor at Wayne State University's School of Social Work, and she conducts research on substance use among marginalized populations and the impact of parental overdose deaths on children and families. Prior to her academic career, she was a clinical social worker serving in the fields of behavioral health and hospice and facilitated bereavement camps for children and families in Michigan and beyond. In addition to her academic work, she currently serves as a volunteer bereavement group facilitator at the same place where I volunteer at Ellie's Place in Michigan. And not to embarrass her, but I just wanted to say that I recall seeing her in a clip on the news, and she spoke with such passion about her work working with bereaved kids that I remember thinking, one day I want to work with that person. And that day has come. So I'm really grateful to have Dr. Comp as my colleague. Take it away. Next slide, please.
Thank you, Sean. In this next segment, we're going to discuss strategies to support bereaved children and families at the macro, meso, and micro levels. Let's begin with the macro level. Next slide, please. Childhood bereavement affects every demographic, and as Eric and Sean have mentioned, it poses significant risks to mental, physical, and emotional health. The stigma surrounding certain deaths highlights the need for strong community support. To provide effective support, communities need to know how to care for grieving children. And this requires research, education, and awareness about the risks and solutions. By expanding evidence-based practices, we can ensure that no child grieves alone. Our team shares our findings with organizations that support children, such as the Sesame Street Workshop's Parental Addiction Initiative, which has done pioneering work in this area. Organizations such as Evermore have developed helpful community guides to support bereaved parents, caregivers, and families. Our team also created the HopeHQ.com website, which contains a knowledge center that offers support and resources to families affected by overdose loss and the professionals who help them. Our goal is to raise awareness and reduce stigma around this type of loss. Next slide, please. It's very important to separate the disease of addiction from the person. In support groups like Al-Anon, loved ones of individuals with addiction learn the 3 C's. They did not cause the addiction, they cannot control it, and they cannot cure it. Addiction is a disease rather than a reflection of a person's character. And this is highlighted in a quote from a research participant in the study that we mentioned earlier. Your loved one isn't or wasn't a bad person. They didn't choose this. I think the more people can understand, again, about addiction, about mental health, and the connection between the physical body and the emotional body, that it could be a comfort. Next slide, please. It's important to understand geographic areas where bereavement needs are not being met. We need to identify communities where children and families have limited or no access to grief support. By mapping these bereavement service deserts, we can then pinpoint under-resourced counties and regions where families affected by parental overdose deaths may be navigating their grief without adequate support. We'll show how we've used data to identify areas in Michigan that lack grief support. This helps us target our efforts and resources effectively. By using data to guide our decisions, we can focus on the communities that need it most rather than relying on assumptions. Our approach can be used in other states to assess bereavement services and identify areas of need. By combining data from vital records with statewide service assessments and then using mapping technology, we've developed a model that can be adapted to other regions. This can help build a more comprehensive support system nationwide. Next slide, please. In our statewide study, we examined 162 bereavement agencies and their geographic service areas across all 83 Michigan counties to understand how well current resources align with population needs. By linking agency locations with county level data and then creating detailed maps, we're able to visualize both the burden of parental drug overdose bereavement and the availability of bereavement services. This first map that you see on the left side shows the number of children who lost a parent to drug overdose per 1,000 children by county over a 22-year period. The counties with the darker shades indicate higher numbers. Next, please. The map on the right compares the number of children who lost a parent to drug overdose to the number of bereavement agencies by county. The darker shades indicate counties with more children in need relative to available bereavement agencies. This is especially pronounced in urban counties like Wayne, Oakland, Macomb, and Kent, as well as several rural counties in the Upper Peninsula. Together, these maps show that bereavement service deserts exist across both urban and rural Michigan, highlighting the need for targeted resources to address these gaps. Next slide, please. An example of a macro level risk reduction strategy is the Substance Use Disorder Services and Licensed Programs website that's regularly updated by the Michigan Department of Health and Human Services. It contains program sites throughout the state as shown here. There are other examples of state level risk reduction strategies that exist that can be used to prevent overdose deaths. And now my esteemed colleague and member of the HopeHQ team, Melanie Touchard, will focus on meso and micro level strategies to support bereaved children and families. Melanie is a doctoral student at Binghamton University's Cognitive Psychology program. Her interest and passion in grief work emerged from her experience as a bereavement group facilitator at Good Grief, a community-based organization in New Jersey that supports bereaved children and families coping with death. Next slide, please.
Thanks, Louisa. So now staying on track with the meso level, one thing to keep in mind as well is how schools respond to the bereaved child. So the school's response can play a pivotal role in facilitating their healthy development. And so some form of these issues that need to be addressed by the school are those that you can see listed here. So welcoming the child back into the classroom, informing classmates about the death, how the teacher can support the bereaved child, providing additional educational support, and also supporting the bereaved caregiver. And wanting to turn the attention to the last bullet point, it's important to note that family structure may change after the death, right? The opioid epidemic has contributed to lead to an increased number of grand families where the grandparents become the primary caregivers of the surviving children, or kinship families where another family member, such as the aunt, uncle, or adult sibling, assumes responsibility for the surviving child. And these forms of changes in family structure can involve a formal process where it is included in the child welfare system, or informal processes where the family member assumes non-legal custody. But regardless of how the family structure has changed, it's important to note that schools should be ready to support not only the child, but supporting the caregiver as well. And what's interesting is this idea about support isn't iffy across the terms, in that some schools feel that they support really well and others don't. But in a survey by the New York Life Foundation, they conducted amongst American Federation of Teachers and found that 93% of educators agree that childhood grief is a serious problem that deserves more attention from schools. And so in response to this need of such a high statistic, the New York Life Foundation has launched the Grief Sensitive Schools Initiative to better equip educators and other school personnel to support grieving students. And you can find that link here down below. And its purpose, when you open the link up, is really to raise awareness about the prevalence of childhood bereavement and grief in schools. What they offer there is to show support to school districts and the schools themselves in striving to become grief sensitive through tangible resources, training, practical tools, and connecting them to a network of supportive services instead of feeling not knowing what to do. Next slide, please. Also on the meso level, something else to consider is these bereavement support groups and how children receive these forms of support. And it's important to note that when children who have experienced parental overdose death are often placed in support groups with children who are grieving other kinds of deaths, right? And the reasoning for this mixture of different deaths between groups could be due to the child not knowing yet, being unaware of the cause of the death, or potentially the number of children seeking bereavement support for an overdose loss. In many of these bereavement services, as you may know, they stratify children seeking support by age, and that presents additional challenges, right, to create a specialized group due to the limited resources of what they could provide. But in order to challenge that idea of having limited funding and being able to have a group that only supports parental overdose deaths, is some agencies have moved towards having a specific evening, right, so that focuses on parental parental deaths due to overdose, homicide, and suicide. So children and their families who have experienced these forms of deaths can be in groups with one another and receive support. Next slide, please. So now I'm going to be turning attention away from the meso level into the micro level of the individual, the child themselves, and different forms of intervention strategies and good resources to turn to. So when we think about trauma-informed assessment and effective grief care for children, Sean mentioned this earlier, but Dr. Julie Capel's work really offers a strong framework for understanding what high-quality, developmentally informed care can look like. And Dr. Julie Capel's work she's a clinical child psychologist at the Executive Vice President of Trauma and Grief Programs and Policy at the Meadows Mental Health Policy Institute, where there she leads the trauma and grief centers in Houston and New Orleans. And her work emphasizes comprehensive clinical assessment that identifies both trauma exposure and grief reactions. It uses the use of validated tools to determine functioning, and it also presents a tiered model of care that matches children to the appropriate level of intervention. And so through their approaches like multidimensional grief therapy, she highlights the importance of addressing the needs of the whole child, integrating play, creative expression, and caregiver involvement to support emotional regulation and mean making. And she offers these through practical examples of group-based strategies, such as structured expressive art activities, narrative sharing, coping skills practice, and the healing power of shared experiences, all of which can be incorporated into grief groups for children bereaved by parental overdose. And so beyond this idea of what she's presented of assessment and treatment matching, a major theme in her work is supporting the whole child in a way that fits the developmental stage. And so this really means creating a safe, judgment-free space where kids can express grief, reduce isolation and stigma, and build coping skills with support from caregivers. And many grief programs support this need with children processing loss through hands-on, age-appropriate activities. And this can be seen if you have volunteered or worked at a bereavement support group such as SAND therapy, where the children mimic and reconstruct memories of what has been in the funeral, to be able to reconstruct the feeling of the death in the sand, also playing with dolls in the hospital. And these activities can help them express emotions in ways that feel natural, such as play-based approaches, art and creative expression, storytelling, and memory making. And so when these activities happen in groups, they also build peer connection. So hearing Me Too from other kids can normalize these forms of grief reactions, reduce loneliness, and strengthen resilience as children practice coping strategies together and learn from one another. Next slide, please. So for children who are aware of their parents' overdose death, like Sean mentioned, it may be really difficult for them to share openly because of the stigma surrounding their loss, right? And people not wanting to listen to it because of how this experience went on. And so we often hear from the children we work with that my friends have no clue what to say when I talk about my mom who died of a drug overdose and immediately tried to change the subject so I don't have to talk about my mom anymore. And this idea of feeling not open and not willingness to express it really could stem into this idea of isolation and lack of understanding from children. And it speaks to the need of increased awareness, education, and support. And by providing education and raising awareness about the situation, we hope that people will become more comfortable providing compassionate presence to those who have experienced an overdose loss in their death. And this needing this form of education to have open awareness is expressed in this quote here from a bereaved sister. And the quote says, "I think the most helpful thing is for people to not tell me that they understand, but to just say, I'm here if you need to talk about it. I'm here. I will listen." Next slide, please. And so despite what's been mentioned about this need for awareness, and despite the findings that more than 1 in every 5 parental death is due to drug overdose, there's surprisingly little work in the field addressing specialized interventions for children who have experienced a parental drug overdose death. And much of this gap stems from limited funding, a lack of program evaluation, and an overall scarcity of rigorous tested interventions tailored for this population and bereavement. And this can be more generally seen in a recent HopeHQ report. And it's important to ensure that children and families bereaved by overdose deaths receive appropriate care as they experience more complex grief and require higher levels of support. And so addressing these limitations is truly a priority for our team, and we hope to dedicate a future webinar specifically to reviewing, evaluating, and advancing interventions for overdose bereaved children. Next slide, please. And with that being said, we want to thank all of our contributors, including our HopeHQ team, the University of Michigan Center for the Study of Drugs, Alcohol, Smoking, and Health, the Wayne State University, the Institute for Research, Education, and Training in Addictions, and many community and state partners. And also thank you for listening.
Thanks, Melanie. So, where do we go from here? So some next steps. Clearly, I think you've heard a little bit related to practice, policy, and research from my colleagues. On this bullet point, I think we'll continue to think about the implications here, and that may have stimulated something in your thoughts and the roles that you play in your communities. Another thing is regional organizing to formulate a steering group, performing a landscape analysis on these resources which are available, not only bereavement centers, but other resources that may be available to funeral homes, schools, and others in our region here in the southwestern Pennsylvania, so that we can develop and disseminate these resources or develop those that are needed. We're actively working with some colleagues from a local health system to begin to assemble a steering group like this. Maybe you'd like to do that in your community as well after what you heard today and what you may know from your roles. We also hope to outreach with other states to promote similar assessments that you heard from Louisa and Sean and what you heard today, to promote similar assessments of children who've had this experience. Every state has the materials that we use to do this for Michigan and what we did here in our local county, but every state has vital records that can be used to begin to generate these estimates. If you know a state, your state that may be interested, please feel free to reach out. We'd be happy to guide folks through this. Finally, this is, at least our first webinar on this topic. As you heard from Melanie, it will hopefully not be our last. We have a couple of ideas for some future webinars, which now that you're connected to us, we'll try to stay in touch with you. Hope you stay in touch with us, but put this out through our channel so we can have you back and perhaps your colleagues who may be interested in this topic. Next slide. So here's our contact information. Notice this is a general info at. So, send us your question, thoughts, if you'd like to be in touch with us or you're looking for materials or to connect with something that we mentioned today, we'll be happy to get that out to you. And you'll have this in the slides when they're distributed. And next slide. I think that's just our references, correct? All right, so I'll turn that back over to you, Marla, correct? To kind of guide us through the discussion portion of the show.
We did have a few questions come in during the presentation that were directed to Sean, but I would invite everyone, all the presenters, to come back and we can have a little bit of a Q&A time and discussion. But Sean, someone asked, which evidence-based interventions is your team currently looking into?
Yeah, great question. So the evidence-based interventions that we were looking at actually comes out of the work from Julie Kaplow. And what we were really interested in looking at is whether bereavement agencies provide kind of bereavement 101, and across all of the different activities that they do, can they map onto evidence-based bereavement care? And so that's where, as many of you know, bereavement really kind of spans across a lot of different settings. Some of it happens in healthcare settings, some of it happens in community, some of it happens in schools, some of it happens in palliative care. So there's really not a natural home, if you will. And the interventions that we are interested in were currently being delivered in some of these bereavement agencies, but they hadn't been evaluated. And so I'll say that for some of the ones that we're looking at right now, we're trying to create the evidence for some of those approaches. But definitely look at Julie Kaplow's work. I think she does a really good job of breaking down really detailed assessments, because not all kids are appropriate for some of the group-based bereavement care. And there's some kids, about 20% or so, that need a higher level of care or a different level of care. And that all comes down to the assessments that are done, not the intervention. So I think if you take anything away from today, it should be this, that carefully assessing these kids and these families will help set them up for success. And most of them are appropriate for like these kind of, more general bereavement programs, but there is going to be a percentage of kids that does need a higher level of care. And so there's really not a one size fits all intervention that's going to work for all kids. And I just kind of bring us back to the importance of doing a careful assessment.
All right, Sean, thanks for answering that. There was one more that came in during your portion of the presentation. Any information, how many witnessed the death of their parent? How many meet criteria for prolonged grief disorder? And how many benefit from prolonged grief disorder treatment?
Yeah, again, great questions. I'll say that from the data that we've looked at, most overdose people who overdose and die are found by family and friends. Anecdotally, it's generally not always the kids, but when it is the kids who find them, oftentimes there needs to be a deeper dive into that experience. And I'll say that the question about the prolonged grief disorder, that's actually something that I can point you towards Julie Kaplow's work, and the ratios of what percentage have that disorder versus not. That's kind of the next wave of research that our team is interested in doing, is looking at how that may differ by different causes of death, because there really hasn't been, like my other speaker said, there really hasn't been a deep dive into some of the nuances and differences by these different causes of death. And that's one question that I think is really important, is how many meet the criteria for prolonged grief disorder. And hopefully that comes up in the assessments that we're doing, because like I said, not all kids are appropriate for the same interventions. So I hope that answers your question.
Thank you, Sean. Elaine wrote in, recent death of my niece, age 13, grandmom, will share with niece's mom. Thank you. Thanks, Elaine, for sharing that with us. We're glad that you're here.
Marla, could I reflect on that one, Marla?
Sure, go ahead.
I also added a heart there. Um, but I think, one thing I don't think we emphasized as much in our presentation. We're focused on children. But that change of caregiver, and there are a lot of grandparents, that either supported their grandchildren, during the person's, drug use, and perhaps after. And, there's opioid settlement funds. 10 years ago, I remember there was some introduced federal legislation acknowledging the kind of responsibility of, grandchildren raising their grandchildren. The generation that experienced the overdose death. But I just wanted to acknowledge that. And I think, some of our participants, especially, that comment just made me think of that. I just wanted to be sure to acknowledge that during this discussion.
Thanks, Eric. Another question that came in, I'm interested in the school as a space for support. Are you aware of systems or policies that ensure all future teachers are aware of bereaved children? And I think that can go to any of our presenters.
I can take that one. I'm not aware of any universal policies, but I do know on the slide where we talk about how to help prepare schools, there is a link at the bottom of that slide that offers resources that schools can use to help teachers prepare for kids coming back to school after a death has occurred. I also know that sometimes bereavement agencies, as part of their community relations and networking and really looking at a more expansive way of providing support, they could connect with schools and provide in-school programming, like a bereavement support group in the school building for kids, for students who have experienced a death in the family. So those kinds of connections do exist. But I know that the link that is in the slide talking about schools, there is resources provided by the New York Life Foundation that helps schools prepare or how to support bereaved children, bereaved students in the school system.
Yeah, and I wanted to jump into this is Sean. I think that question came from Terry Powell, who's doing great work herself in this space. And as far as schools being a place of support, I want to highlight the fact that when we did some of our bereavement desert mapping work, we recognized that in some of the communities where bereavement was most needed, it was sorely lacking. And some of the bereavement agencies rely heavily on volunteers and rely heavily on, having enough people to provide these services. And so in some communities where that might not be as feasible, their schools become a very important setting to do some of this work. And so I just want to call out the fact that if we're really thinking about health equity and how do we bring this, it's hard to build infrastructure very quickly, in our communities. That can be an eventual goal, but if we really want to close the gap, schools become a very important place that we can think about, to where we can provide some of this type of care in the schools. It really just needs school teachers, which my mother was one of them. It really needs champions at schools to have teachers, take an interest in this and step forward as far as bringing this to people's attention. Thank you for the question, Terry.
So if anybody would like to ask a question or share a comment on camera, or just through your microphone, if you would like to raise your hand, we could unmute you. If that, I can take you off mute now. I can keep reading through these as well. It looks like Tamara has a question. Let me see if I can unmute her here. All right, Tamara or Tamara, I'm sorry if I'm mispronouncing that, but you are unmuted. Feel free to share. Maybe it looks like she's unmuted, but maybe the mic is not working.
Why don't you go ahead and read her question, Marla? I think she restated it recently. I'm not familiar with that, but maybe Sean or Louisa is.
All right, here it is. Grief Recovery Method Institute evidence-based recovery to help people bring grief to completion. Any thoughts on the grief recovery method? Or if you've heard of it or not? Seems like maybe Sean or Louisa have not heard of it.
I personally have not heard of it. Sean?
Okay.
Yeah, with our kids' work, I might need a little more detail on exactly what method she's referring to, but I'm not familiar with that with kids.
Okay. So Justin has his hand raised. We can try to do the unmute thing again. Let's see if this works. Okay, Justin, you should be unmuted.
Came here to say thank you.
Oh, we can hear you, Justin.
Hear me?
Yep.
Okay. Just very grateful to be here. That's it.
Oh, well, thank you so much. We're glad that you could join us.
Thanks, Justin.
All right, let's see. There's a few more. Are you all comfortable still going through some of these questions that came in through the chat box since we have some time? Okay. Has any research been done that demonstrates the number of grieving students who drop out or end up in alternative high school settings? I worked in one of those schools, and a large percentage of those kids had deep grief issues around drugs and alcohol, incarceration, death, and loss of relationships.
Yeah, I'll jump in and answer that. I think that's coming from Lynn Malinoff, who does great work in this space. I mean, she's really been a champion in those schools. I will say that we see a higher rate of school disengagement and both stop out and drop out. One thing that obviously the focus today was on overdose, but I just want to call out a couple things. One is that sometimes overdoses don't result in death, but they result in some pretty severe impairment. And sometimes kiddos are now in their household with a parent who might not be what they were before. And so that can have a real impact on school too. And so I think schools, even if there isn't a death, but there is an overdose that might be associated with some of that impairment, whether it's dropout or stop out, because we like to distinguish those two. I think that's another role for schools to intervene. As far as the percentages of that, I think that's something that our team is very interested in looking at, is getting some of those numbers. I know Eric and I have talked long and hard about like having an integrated system to be able to see where kids experience problems. But if we wait for dropout, it's too late. And so that's why like there's systems out there in other states, Washington being one of them, that provide early signals for kids who are missing school or who are struggling in classes, which are much earlier signs than dropout. And so I would just challenge us to all think about ways that we could develop signals for some of these kiddos so that we're catching problems much earlier than for them stopping out or dropping out, because that's just far too late to wait.
Thanks, Sean. All right, let's do one more question and then we can wrap up for today. For children who have special needs and have experienced loss due to drug overdose, how are they being supported? All children deserve the support, but children in special education tend to have longer processing times, especially when loss is involved. Do any of you all have any experience with that?
I'll just say really quickly, and then I'll turn it over to Luis and Eric. My experience with that is that a lot of times in like community-based programs, we work with kids with disabilities and simply involve the other kids in how to support their peers. And we work around those if there's, language issues, or if there's, hearing issues, whatever the issue is, we try to work with the other kiddos to have them be understanding and learn how to support their peers. So that's how we've dealt with it. If there's issues that require a higher level of care, then obviously you have to adjust. But generally, we try to in groups, we try to keep all the kids together and supporting one another.
I also know that often bereavement organizations will assess for any special needs and try to accommodate that as much as possible, but it really like how the team is able to respond often then is dependent on like what staffing is available, like who is actually doing the bereavement support and their comfort level too. So it's a very it can be a tricky situation, but we try to be as inclusive as we can in addressing the bereavement needs of children with special needs.
All right. Thank you. Well, we will go ahead and I'm going to close with some last minute housekeeping items. If you'd like to hear how to access CEUs again, I am just going to go over that quickly. Thank you so much, everyone, for your thoughtful questions and comments. We still have a lot of great, lovely comments coming in, thanking Eric, Sean, Louisa, and Michelle. Or Melanie, I'm so sorry. Thank you, everyone, for attending today, especially the folks from HopeHQ for presenting on such an important topic. Once the webinar concludes, you will receive an email that includes the webinar recording, slides, and instructions for CEUs. This email will also include a link with a brief feedback survey. We ask that you fill that out as it will help us shape our webinar series in the future. It shouldn't take any longer than 5 to 10 minutes of your time. So this webinar is approved for 1.5 PCB and/or NADAC credits, which are free. A standard certificate of attendance will also be available for download. If you would like to obtain CEUs for attending this presentation, you will need to do a self-attestation and fill out a brief survey or a brief essay question after the webinar. You can do this by taking the following steps. You'll log into your My IRETA profile or create a new account. I can copy and paste that into the chat as soon as I'm done reading these instructions. This link will take you directly to the page for the webinar. You'll answer the attendance questions and the brief essay question. You will then receive an email letting you know when your certificate is available. Please note that it may take for up to a week for us to process certificates. It is possible that this email may go to your spam folder, so please check there as well. You can also log into your My IRETA account to check on the status of your certificate. And you'll see here, if you would like to sign up for our email newsletters to be notified of other webinars, please feel free to sign up at the link at the QR code. And also feel free to let me know if you have any questions about today's webinar or CEUs directly at my email at marla@ireta.org. And with that, if our presenters don't have anything else, I will conclude the webinar.
Thank you, everyone, for attending today and sharing your thoughts and questions.
All right. Thanks so much, everyone.
Thank you.
Bye-bye.